So we're here this morning with Jim Wilusz. He's the director of the uh, Tri-Town Health Department.
Yes.
Okay, great. And we just wanted to ask you some questions today, Jim, about the virus. Your town is responsible for Lenox, Lee, and Stockbridge. Are the statistics for the virus in those three towns pretty much the same, or is one town faring worse than others?
Yeah. As of yesterday, the Department of Public Health made a decision to start reporting by town.
Mhm.
So I can actually say that the numbers as of today, there's a little bit of controversy early on because they were concerned about HIPAA and violations, and especially smaller communities on reporting by town. Now I report by town to dispatch, that's my responsibility. But now with the DPH issuing a new order by reporting by town, it's actually public information now. So yeah, I mean, Tri-Town Health District, we cover Lee, Lenox, and Stockbridge. We're one of the oldest health districts in the Commonwealth of Massachusetts. We're a formalized district where all three towns buy into sharing, and there's revenue. It's a formalized system. We've been around since 1929, one of the oldest around.
Oh, I guess so.
But yeah, so to get to the answer, obviously Lee and Lenox are a little bit larger in population as compared to Stockbridge. Lee and Lenox are a little bit higher as compared to Stockbridge, but not by much. Our numbers have been relatively manageable, knock on wood today. Lee has about 11 cases, Lenox is at 9, and Stockbridge is at 5. Now, those watching this video later on, once you publish it, may see a little bit of a variation on what the Department of Public Health is putting out versus what I'm saying. But it really all depends on when you look at that list and when DPH pulls their list and when I pull my surveillance list in Maven. So there's always going to be a little bit of variation there. So the numbers seem low as compared to some other communities. Hopefully it stays that way. It's still been a lot of work, but yeah, Stockbridge is a little bit lower, smaller population as compared to other towns.
Do you oversee the need for medical protective equipment, that type of thing to the three towns, or are the three towns administrators responsible for getting that type of equipment for their EMS departments?
Yeah, good question, Leo. So basically, in the early onset of COVID-19, there was a big concern about the availability of PPE, surgical masks, N95s, not only in the clinical setting, but for our frontline first responders, EMS, police, and fire. I don't technically handle that because these other departments, like the EMS directors, like Chief Ryan Brown, Craig DeSantis, Chief O'Brien, Vincent Garofalo, and Stockbridge, they're all part of the Southern Berkshire, Emergency Preparedness Coalition, and they were doing a fantastic job being able to secure that PPE for the first line responders. And so I've been supportive. So I'm sort of like their link to the Department of Public Health and NEMA in certain cases, because I'm directly responsible for the command center for the DPH. So I was sort of advocating behind the scenes, making sure that they get enough PPE equipment to last through this pandemic. So not directly, but more or less indirectly.
Right. I saw in the news last night that Massachusetts took a sudden spike in total cases. Have you been pleased with the governor and his coordination of preparedness?
Yeah, I mean, I think all agencies have done a fantastic job.
Right.
It was a little bit bumpy at the beginning. We're talking early March leading into this. I had some concerns early on, and I worked with Smitty Pignatelli and our Berkshire delegation because I felt the Berkshires needed a larger voice being out so far out where we are. When we started to see multiple cases in Central and North Berkshire, we worked behind the scenes to get information to the governor's office to make sure that we have specific epidemiologists dedicated to the Berkshires. Because if you remember weeks ago, that first wave of the Berkshire Health Systems employees initially being furloughed, and we started seeing cases, the Berkshires, we have a great community. it's a mixture of the rural and, rural communities, mostly rural. And it was really important for me to get that message to Smitty and others to get to the governor. If you remember, the governor had a meeting. He came out to the Berkshires, went to the city of Pittsfield, had a big meeting with the mayor. Well, there's 31 other cities and towns in the Berkshires that we wanted to make sure, in our smaller communities, that our voices were heard, because the needs are somewhat different compared to the rural communities as compared to the urban cities and towns. But overall, it's been excellent. I think the governor's done an excellent job. The Department of Public Health has done an excellent job. I mean, we were able to fast track an emergency grant through our Tri-Town district to cover incurred costs for Tri-Town Health, whether it's backfill, supplies. We had to hire multiple nurses. I have never seen government move that quick in my life, Leo, to get money into our account in real time. It was quite impressive, actually.
That's the best good news story I've heard, and I've done a lot of these interviews, and that's really terrific. I spoke to Smitty maybe 2 weeks ago, and at that point he said that Massachusetts, under the big umbrella of coordination, seemed to be ahead of some other states. So kudos to you, and to the governor and to the people that really made that happen. Governor Cuomo yesterday said that he may, when it's time to reopen New York, he may insist on wearing a mask outside, or a mask I think it's a mask if you have to break social distancing.
Yes. Yep.
Do you think we'll go that route? And if we do, where do you find the masks? Will they be available?
Oh, great question. I've been talking about cloth masks for about 3 weeks now. Right now, the Commonwealth of Massachusetts, Governor Baker did issue an advisory on wearing cloth masks. With that comes a lot of questions, and, I'm getting bombarded with our thoughts on that. I think there's some mixed messages out there that it's mandatory, it's required. Health departments are going out to enforce this. Right now, it's an advisory. Unless a formal municipality issues like an executive order that goes above and beyond the governor's order, which could be legally questionable, it's an advisory. Now, we all know, surgical masks and N95 are the appropriate methods to slow down the transmission of disease, right?
Yes.
And so with the governor's advisory, which I fully support, our district sent out a mailing, and I'll talk about that in a couple of minutes, to we have a lot of permitted establishments in our 3 towns. I think that's the best we got, right? My biggest concern is accessibility. Where are people going to get cloth masks?
Exactly.
Some people are reverting to homemade masks, which are great, but not everybody has bandanas and, wants to rip apart pillowcases. And so there's ways of getting around to create masks effectively. But you're right. If we were to mandate this, Leo, we're talking all the grocery stores, multiple employees, multiple shifts, the general public. If we're going to mandate something, this is my opinion, not saying it's going to happen, we need to make sure that people can access these cloth masks. And while cloth masks haven't been found to prevent transmission, that's the best we got, right? With the unprecedented times that we have. So do I see us going down a road of mandating it? Not really sure, but that's a tough nut to crack from an enforcement perspective, right? We're talking social distancing and stay-at-home orders. We're essential employees, but like sending my staff to every single store multiple times, we're not helping anyone out either, right? Because we'll be wearing cloth masks, which we know is not 100% effective, but that's the best we got. And kudos to all those people, Leo, out there. They're doing their best to wear cloth masks, whether it's a scarf or bandana. That's the best we got in these unprecedented times. So stay tuned, I guess, if we hear more.
Yeah. Well, I guess LA and New York, they do plan on enforcing it, so I'm not sure how that's going to go. And I know in China that they've set it up that there's cash, it's almost like a bounty, there's cash rewards for neighbors ratting out other neighbors who are not protecting themselves outside. So, and that was going to be my other question because of the virus. Are you stretched thin on your department, or is everybody still working?
Right.
And
Yeah. Yeah, we're
you,
in good shape. Yeah.
you
We
just mentioned, I'm sorry, go ahead.
no, go ahead, Leo. It was a little bit of a delay. Go ahead.
Yeah, and you said something interesting a second ago that would you send your some of your folks out to enforce uh, protection outside. So that is part of your job then. You actually send people out to check on health matters.
Absolutely. So yes, we are deemed essential services, and although the building is technically closed to the public, we're working. It comes in different forms. I don't need all 4 full-time staff members sitting in the office in close proximity of one another. Some people are in the field, some people are working remotely. We're doing a lot of my inspectors are doing a lot of work behind the scenes without physically going to the store. I mean, we've sent out thousands, and I'm not kidding you, thousands of mailings, emails. We've checked in with every store that's still open, asking for whether their procedures, whether all the governor's mandates, no self-service. We don't want people accessing fountain drinks at the fast food restaurants.
Right.
I mean, it's as simple as we don't want people just handling coffee cups. They have to be in a single-use dispenser and everything else. So I feel our 3 towns are doing the best that they can in these circumstances. We've gotten minimal complaints on non-compliance. I mean, I work with all the police chiefs and the select boards, and I think there were some earlier iterations of some gatherings a few weeks ago, and I think Chief O'Brien talked about that in Lennox. But for the most part, notwithstanding the advisory of the mask, which we still know is not required, I think our larger grocery stores and our food establishments are doing a really good job, at least to my knowledge. But to answer the question, yes, if we feel the need to send inspectors out based on egregious non-compliance, we're there. Everyone's on standby. But I also feel my philosophy, we have such a great relationship in our 3 towns. I mean, we always have issues here and there, right? Nothing's perfect. You gotta remember, Tri-Town's been around since 1929.
Right.
We're a formal district, and we work really well with all our permit holders. And when they get correspondence from us, or they get a personal phone call, most people take it serious. And we know stores can't control people coming in without masks. Some stores can't get access to masks. Are they wearing them right? How do they clean them? Those are challenging questions to answer, but I feel like our 3 towns are doing a really good job. And I don't want to, I know I'm biased.
Go ahead and toot that horn.
But I feel, I tell you, we got an excellent team.
Right.
Between down to the select boards, we've always had strong relationships with our police departments, fire departments, EMS directors, finance committees, select boards, and Tri-Town Health is fully staffed. All 3 towns invest into a formalized professional health department, and we've been working towards handling something like this for a long time. It's not the same response in some of these small towns. They have limited part-time staff, volunteers aren't getting paid. Tri-Town's a fully staffed department, and we're ready to handle all this stuff as needed. Has it been challenging? Absolutely. Totally unprecedented what I've been doing and this department's been doing. And I'm on my 20th year doing this.
Wow.
I've never would foresaw what we are going through now. But I feel really confident with all the work that we're doing. We're all in lockstep with one another. And when we come out of the other side, Leo, on this, we're still a community that have to work and live and play together.
Yeah, absolutely. What a great response. You have other fires, I'm sure, that need to be put out. With the virus being in the forefront, are you able to do any of what your department did prior to COVID?
let's put it this way. We're about 100% COVID right now,
Yeah.
to be honest with you. I mean, we have a multiple faceted department with a lot of different programs when we're in calm days. We have a comprehensive pool inspection program. We have a laboratory where we test pools and beaches and ice. We have our septic program. We push out about 3,000 inspections a year in our district, which is a lot.
Yeah.
But 90% of the mandates under statutory law is commercial. So if you take that, you slim that factor way down, there's not much going on other than we're really triaging COVID-19. That's the number one priority, albeit we get a call that someone's septic system's backing up in their yard, we'll respond and we'll deal accordingly with that. But again, I feel like at least our philosophy is everyone's so overwhelmed. The stores are overwhelmed. Grocery store workers are scared and nervous. We're working with them. We're supporting them, all at the same time, making sure that they're towing the line too with requirements. We're also there to help them and not be punitive unless we absolutely need to. Public health is about monitoring, prevention, education. Obviously we inspect, but the enforcement piece is a tool to achieve compliance, not the other way around, in my opinion. Our philosophy is not to start enforcement. It's, hey, we got a complaint, John Doe grocery store. We talk to the manager. What are you doing? We work together. But when we end that conversation where we're trying to triage that issue, these are relationships that we've built with these stores over the years. I mean, nothing's perfect. We always get the restaurant that during regular times, Leo, they don't like it. We have to make them paint the wall or something. We deal with that. But globally speaking, for in our three towns, it's been pretty good, very responsive. And we have spent so much energy and resources reaching out to our stores. We're calling every store weekly. We're checking in, seeing if they need anything from us. Do they have the right information? What we can do to support them. And I'll tell you, the response back is thank you, thank you, thank you. Thank you for reaching out and helping us out. And like I said, the punitive actions are there as a necessary tool to maintain compliance. And so far, been a couple bumps in the road early on. We've gotten minimal complaints from people.
That's great. That's terrific. Do you handle testing? And is there testing taking place in Berkshire County, or is it at the hospital only for admittance?
Yeah, so we're not handling any of the testing for COVID-19. I mean, it is different iterations. The hospitals testing. You may have read that the governor has dispatched the National Guards to certain nursing homes across the Commonwealth. They're doing some testing. The health systems, they were doing the drive-by testing. I'm not sure if they're still doing that. Quest Diagnostics and other agencies have begun testing. So we're not directly doing the testing, but I am the gatekeeper. So I'm the first one that gets notified when there's a suspect COVID-19 case. And it's my job, and I have nurses on retainer that do all the case tracing investigation, and then I report that to dispatch as required by the governor's order. So I actually get all the data in real time.
So if testing was needed, there's at least enough kits for on-the-fly testing if it's needed.
Well, I don't know if I know the answer to that, right? I mean, there's more tests being ramped up in the Commonwealth than nationwide, but is it anywhere near where it should be? I don't think so. And, I don't know exactly where that capacity is now, 'cause it's something I'm not directly working on. But, as we start to look post May 4th and everyone's talking about how we're going to reopen the economy in piecemeal, piece by piece, I would think that we need some type of comprehensive testing component if we're going to get to that point. But you see what China's going through now?
Yeah.
They're in this second wave.
Yeah.
I don't have the answers, and it'll be interesting to find out over the next week and a half what the governors are thinking with their pact with the Northeast states. But we need to do this methodically and carefully. But it's a challenge.
Yeah, that was going to be my next question is about opening the economy. I mean, there's some senators who want to open tomorrow, testing be damned. And then there's governors who say, we're going to control the rollout of reopening and we're not going to do it until it's safe. Are you worried that the government may force opening prematurely?
Possibly. I mean, it's we don't know exactly how, we don't know much. We know I would think that needs to be carefully weighed and balanced. I mean, we can't close forever, right, Leo? I mean,
Yeah,
our
yeah,
economy is in tough shape just with a short period of time. Maybe they do things in piecemeal, slowly but surely, work backwards. I mean, I have two kids that go to school, and are the schools going to open back up in close quarters for one more month while we're still seeing cases?
yeah.
That remains to be seen still, right? That's a decision by the school committees and town by town. And we have seasonal camps that are breathing down my neck wanting information. I mean, there are hundreds of camps around, the seasonal pop, and we're seeing large seasonal tourist events being canceled for the summer. It's hard to predict what's going on, but it needs to be done in a thoughtful, responsible way with putting public health first.
Yeah.
Because what happens, Leo, what happens when we just open up the economy and we get into the second wave in September? I mean, the fallout after that will be significantly worse, I would assume.
Sure, and especially if you have to shutter everything down again. Absolutely. And then it's really heart-wrenching when you live in an area where 80% of your economy is tourist-based. It's like being on Cape Cod. Nobody knows what the summer's going to bring yet. And if Tanglewood comes out and says they're going to cancel their season, that'll be pretty devastating.
Yeah, I'm getting calls about, from certain schools about what graduation could look like, commencement ceremonies.
Right.
And the way I'm responding to people is like, start thinking outside the box, maybe put some preliminary plans what that would look like in place. But it all hinges on the governor, what the mandates are coming down in their recommendations. I'm sure that's on their plate right now, as we start heading into town meeting season. We're seeing more municipalities put that off to the end of June, even elections. But these are tough. These are tough pills to swallow. These are unprecedented times, but we will come out of this. I rest assure you and your viewers that we are in lockstep. We are laser focused, and we're doing everything in our ability to beat this COVID-19, and we will win.
What a great way to end the conversation, Jim. That was, yeah, for sure.
Yeah.
It sounds like you got all the T's crossed, the I's dotted. I guess it's just a wait and see game now.
Yeah, and again, it's there are people out there that are really doing a wonderful job. I think there are people that are out there trying, Leo, and there's still that group of people, whether it's small or medium size, that just still think that rhetoric of, there's nothing wrong. We all need to do everything in our power to get through this. And let's get through it. Let's get through it the right way, do it the smart way, and we're all in this together. And I'll tell you, I'm so thankful to be working for this district. I've been part of Tri-Town since 2002. And I'll tell you, just the outpouring from the community, the gratitude, it's unbelievable. Even all that going on when people are stressed out to the max, people are still respectful. And whether, the good, the bad, and the ugly comes out during this pandemic, right? But when it's all said and done, we're still neighbors, we're still family members, and we're still part of a community. And that's what we need to focus on.
Well, that's great. We're thankful for your group, Jim, and we'll end it there. Jim Wilusz, Tri-Town Board of Health. We really appreciate it, and you stay well.
You stay well, Leo. Thank you.
All right. Thanks a lot. Take care now.
Well, you're welcome. Bye now.
Bye.
Bye.